Few experiences will challenge a veteran service officer more than engaging in a conversation about military sexual trauma. This issue has received a great deal of publicity, and it is well deserved. For a long time, society at large has either ignored or shied away from this sensitive topic. It's going to take a lot of work to meet the needs of all veterans who have suffered in this manner. Military sexual trauma is defined as a sexual assault or repeated threatening sexual harassment that occurred during a veteran's military service. The MST can occur on or off base. It can occur on or off duty, and the identity or rank of the perpetrator doesn't matter. In fact, the perpetrator can even be a civilian. It's very important to understand that an MST is an event. A service member's reaction to the military sexual trauma can take a variety of forms, and we'll discuss those in a few minutes. Types of military sexual trauma include any sort of non-consensual sexual activity. So the following actions are considered military sexual traumas: forced participation in any sexual activity, inability to consent to sexual activity due to intoxication, and pressure to perform sexual acts due to physical threats or threats of consequences. MST can involve oral, vaginal, or anal penetration, but that element is not mandatory for an event to qualify as an MST. MST can also involve threatening or offensive remarks about a person's body or sexual activities. Unfortunately, MST is far more common than anyone would hope for. Through screening questions in the VA system, about 1 in 4 female veterans and 1 in 100 male veterans self-identify as having survived military sexual trauma. Let's take a little closer look at the male number for a moment. Now, 1%, or 1 in 100, may not seem like a large number of male veterans, but remember, there are many more male veterans, particularly from earlier eras of combat, than there are female veterans. So the issue of male military sexual trauma is as real and important as it is for our female service members. We also do not know the real or true incidence of all military sexual trauma. All we have are data collected by the VA from veterans who agreed to answer the questions asked. How many veterans are there who have never stepped foot in a VA or were asked a question at a VA and gave a response that was less than accurate in order to preserve their dignity? Now, military sexual trauma is best defined as an event. It's not a diagnosis in itself. It's something that happened to a person. Sometimes individuals who work with veterans assume that everyone exposed to an MST has PTSD, and that's just not accurate. It's much more accurate to say that PTSD is the most common diagnosis associated with MST. But again, not everyone who's been subject to an MST has PTSD. Other common diagnoses associated with MST include depression, eating disorders, self-harm behaviors, substance use disorders, schizophrenia, and bipolar disorder. Of course, a veteran can have a combination of these disorders as well. It's not uncommon to see a veteran with PTSD, depression, and substance use disorder as a consequence of MST exposure. When we think about physical problems associated with military sexual trauma, it's natural to think about sexual function problems. However, sexually transmitted diseases, unwanted pregnancy, and even obesity, chronic pain, or gastrointestinal disturbances can also occur in veterans exposed to MST. So how is MST picked up? And how does someone figure out if a particular veteran has a diagnosis associated with MST? If a veteran goes to the VA for routine care, questions about MST are universal. These questions are asked periodically as screening questions to every veteran, regardless of gender. Staff at the VA are trained to ask these questions in private and not in an open triage area. If a veteran screens positive for MST in the VA system, then the following cascade of events may occur. The veteran may be offered formal psychological assessment to help diagnose any mental disorders that have not yet been identified. MST can be more difficult to prove because it's often unreported in a service member's official military records. The VA system for evaluation and treatment of veterans exposed to MST is structured differently than that used to treat other conditions. Veterans can receive free MST-related health care regardless of their discharge status or service connection. So if the veteran did not serve for a sufficient time in the military to qualify for regular VA benefits, or if the veteran received an other than honorable discharge from the military, they can still be seen for their MST problems. Why, you might ask? Well, the VA recognizes that sometimes veterans leave their service early or are written up for disciplinary issues such as being AWOL precisely because of their MST. In addition, reservists or National Guard veterans can receive MST-related care even if they did not serve sufficient active duty time to qualify for regular veterans benefits. Finally, pre-existing trauma from the time before military service does not disqualify veterans from MST evaluation and treatment in a VA. Of course, veterans can receive care for MST outside the VA system. Mental health clinicians, including psychologists, psychiatrists, social workers, or other counselors, may have expertise in working with diagnoses associated with MST. The important piece for veterans to understand is that they deserve to see a healthcare provider with whom they feel comfortable. Then they need to have a frank discussion with that clinician about whether the clinician has the training and skills to treat the conditions that trouble the veteran. If indicated, the veteran may be offered individual or group psychotherapy. Also, if indicated, they may be offered medication. Finally, all VAs have some degree of specialized staff who work as MST coordinators. Larger VAs and larger community-based outpatient clinics may have a dedicated team for outpatient treatment of MSTs. As you can imagine, the needs of specific veterans will dictate their individual treatment plans. Female veterans can be seen by female providers in the VA system if they're more comfortable with same-gender care. Male veterans have options too. Some prefer to be seen by male providers, but others prefer to see female providers for a variety of reasons. These issues should be discussed by the veteran at the beginning of their journey into MST treatment. There are a variety of ways for veterans to access evaluation and potential treatment for MST-related problems. They can contact their existing VA healthcare providers, all of whom have been trained in MST triage. They can contact the MST coordinator at their closest VA medical center. The telephone operator should be able to connect any veteran with the MST coordinator at their home facility. They can talk to their OIF or OEF coordinator if they have a relationship with that individual. And finally, they can contact their local vet center. Of course, many veterans seek care outside the VA system, which is certainly their choice. Now, one of the people I mentioned is the VA MST coordinator. What exactly does that person do? The MST coordinator is a position that is present at every VA in the country. And that person is the primary point of contact for all issues related to MST. They're responsible for monitoring, treatment, education, and training related to MST. At larger facilities, they may have clinical and supervisory responsibilities. It's worthwhile getting to know the MST coordinator at the closest VA facility to your territory. They can provide you with a great deal of useful information on MST to help you serve veterans better. Remember that one of the core responsibilities of the MST coordinator is outreach. That means that they have time set aside every month to meet with people interested in this topic. Again, it really depends on the problem or problems that the individual experiences after the MST. So if they suffer from PTSD, then they may benefit from evidence-based psychotherapies for PTSD, like cognitive processing therapy or prolonged exposure therapy. If they suffer from depression, there are a similar list of psychotherapies and other treatments for that condition. If substance use has become a problem, then that issue will need attention in addition to anything else. Finally, there may be relationship problems that could respond to couples counseling. In certain cases, a veteran may be referred to a residential treatment program for MST. These sorts of programs may exist in the private sector, but they may include survivors of different sorts of sexual traumas. The VA runs even more specialized programs for survivors of military sexual trauma. The goal of such programs is a recovery orientation. There's a clear focus on community reintegration. For VISN 6, the closest MST residential program is in Salem, Virginia. It's important to remember that MST can be a very uncomfortable topic to discuss, but that should not prevent us from addressing this critical subject in order to provide the best possible service to our veterans.